You are looking live at the Empire State Building, and in case you missed the point while living in Midtown Manhattan, these days the night skies over the city are lit up with a red light, a beacon indicating the state of emergency on the streets below. Well, good evening once again. Day 1166 of the Trump administration, 218 days until our next presidential election, and 19 days since the World Health Organization declared the coronavirus a pandemic. This was supposed to be the end of the administration's 15-day Stop the Spread guidelines, but it turned out that was wishful thinking. Instead, the coronavirus will not stop spreading within our country. The governor of the Commonwealth of Virginia wants his citizens indoors for the next 70 days. The president, who has backed off his goal of packing churches on Easter Sunday, has now gone along with his experts. He will continue the current behavioral guidelines for at least another month.
Yesterday, I announced that we would be extending our social distance guidelines through the end of April. This is based on modeling that shows the peak in fatalities will not arrive for another 2 weeks. The same modeling also shows that by very vigorously following these guidelines, we could save more than 1 million American lives. Challenging times are ahead for the next 30 days, and this is a very vital 30 days. We're sort of putting it all on the line, this 30 days. So important because we have to get back. But the more we dedicate ourselves today, the more quickly we will emerge on the other side of the crisis.
That was today's message from the White House. Again, a far cry from the push to reopen the nation by Easter. It was followed by a parade of CEOs stepping up to the mic to talk about what their companies were doing, and in some cases, the products they make. There was even talk of sending equipment we don't need to other nations. Those announcements coming in as new cases in this country soar past 161,000 now, with nearly 3,000 lives lost. This morning, we heard a startling comment from the coordinator of the coronavirus task force that put this battle to slow this outbreak into a kind of grim perspective.
If we do things together well, almost perfectly, we could get in the range of 100,000 to 200,000 fatalities. We don't even want to see that.
Just to repeat these numbers, they are talking in terms of 100,000 fatalities to 200,000 fatalities. Those numbers and the decision to set April 30th as the next goal for getting back to business as usual emerged late yesterday.
And I think it's entirely conceivable that if we do not mitigate to the extent that we're trying to do, that you could reach that number. Yeah, it's possible. Dr. Birx and I spent a considerable amount of time going over all the data, why we felt this was a best choice of us, and the president accepted it.
We're going to bring down the number of infections so we don't have 2.2 million deaths or 1.6 million deaths.
So if we could hold that down, as we're saying, to 100,000, it's a horrible number. Maybe even less, but to 100,000. So we have between 100 and 200,000. We all together have done a very good job.
Here is a reminder of what the president said back in February about what he expected to happen by April.
There's a theory that in April, when it gets warm, historically, that has been able to kill the virus. That's around the corner, so that will be a great thing. I think when we get into April and the warmer weather, that has a very negative effect on that and that type of a virus.
U.S. retailers among the hardest hit as Americans brace for long-term coronavirus shutdowns. Just today, Macy's, Kohl's, The Gap announced they would be furloughing the majority of their workers, leaving tens of thousands without work. Growing number of states are imposing strict orders to stay home. Washington, D.C., Arizona, Maryland, Virginia all joined the list today. Virginia's order is the most extreme. That extends out again 70 days, puts us in June. A reminder here that Governor Ralph Northam of Virginia is a medical doctor by training. President Trump said today he has no plans to issue a nationwide stay-at-home order. Some states still refuse to close all non-essential businesses. Among them, Florida, number 6 on the list of states with the most cases of the virus. They happen to have a huge senior citizen population. Governor Ron DeSantis announced today he's shutting down some counties in the southeast part of the state and setting up roadblocks, blaming out-of-staters for the coronavirus cases there.
And so given the New York City area is the #1 hotspot in the world right now, when the New York governor instituted the stay-in-place order, we started noticing a huge uptick in traffic out of the city, many of them coming to Florida. And so we viewed that as problematic.
And just a reminder here, this was the scene during spring break in Clearwater Beach, not in South Florida, just over a week ago. Jacksonville city official posted this image from over the weekend. Meanwhile, New York continues to grapple with the highest number of cases in the United States. There's now a field hospital in Central Park, 68 beds available. There's now a Navy hospital ship docked in the Hudson River, another 1,000 beds. As the hospital ship Comfort passed by the Statue of Liberty, a memorable photo was born in that instant. Chicago, also dealing with escalating cases, will convert its enormous McCormick Place Convention Center into the state's first field hospital for some 3,000 patients by April 24. In Los Angeles, the National Guard converted the city's convention center into a field hospital there to relieve the burden on the city's overcrowded medical facilities. Medical staff across the country have been warning of dire shortages of protective equipment, mostly masks. Yesterday, Trump suggested that hospitals were to blame for the rate at which these masks were being used up, and he threw out that same inference again today.
You expressed some concern in the past that medical supplies were going out the back door and that perhaps some hospitals were doing things worse than hoarding.
I expressed what was told to me by a tremendous power in the business. He said that at a New York hospital. For a long period of time, he was giving 10,000, maybe maximum 20,000 masks over a short time. And all of a sudden, he's giving 300,000. And I said, no matter how bad this is, could that be possible? He said, no. So there's only a couple of things that could happen. Is it going out the back door? And I've reported it to the city and let the city take a look at it. There's something going on.
And tonight, the governor of New York was asked about the president's comments.
The exponential increase in the PPE is real, right? Almost in the hospitals now, there's COVID PPE, non-COVID PPE. Everybody's wearing COVID PPE because you don't know who has COVID, you don't know who doesn't have COVID. Every time they see a patient, they have to change their PPE. So yes, the burn rate of the PPE is much, much higher.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.